Kasim, can you turn on your camera and share your screen? We're going to get our activity started for today. And I think my audio is not on Zoom, so I'll say it again. We're going to start today with a community practice activity led by our community practice coordinator, Al Ghasem Sharaf Adin, joining us from Yemen.
Hi, can you hear me?
Can you speak up?
Yes, can you hear me? Is this good?
Just moving you onto the screen here. Okay, we can see you, and if you could just speak loudly.
Okay, I'll try my best to speak louder than hopefully you'll hear me. Is this good? Hello? Okay, I guess you can hear me now. The game is on. Basically, please start by scanning this QR code or go to community.dhis2.org/game. I'm opening this QR code in full screen so people can scan it easily. But then I think you might be able to use the URL community.dhis2.org/game. Once you do that, you will be directed to this post here, which explains everything, but I'll be explaining in a bit. Basically, we only have until 8:55 Oslo time to finish this challenge. And once you scan the QR code or use this URL, if you already have a COP account, you'll be included in the challenge. If you don't have a COP account, please create one to join and to join the challenge. During the game, once you're in the challenge, any action you take, it will be part of like collecting points for you in the community. You get 10 points already if you have voted in the app competition post, or if you vote now, you also get the 10 points. You also get a 10 points if one of your posts are marked as solved as a solution during the challenge. If you receive a badge, you get 5 points. If you reply to or create a new topic tagged with DAC 2025, you also get 5 points. These are the other points here. Every time you get points, basically you'll see something like we'll see something in the screen with the total points and stars that each person has. Let me read this. Let's see if anyone has joined. Wow, okay, so we already have some people joining, and if they have a star here, it means that they already have 10 points for participating in the poll and voting in the app competition. If you mention another gamer, someone in the game, you'll get 3 points. If you have any DAC 2025 tag post that is in a topic, DAC 2025 topic, or if it's a post and you receive a like, you get 3 points. 2 points if you like view DAC 2025 topics. If you view another gamer's profile, you also get 2 points. If someone views your profile, if you are viewed by another gamer, you also get 1 point. If you update your profile, any update, you get one point, but only works once. So if you maybe upload a picture or change any profile information, you get 1 point. If you're and if you like posts and view topics that are not DAC 2025, you get 1 point. If your post receives a like in a topic, you also get 1 point. If you reply to or create a new topic, you get 1 point. Everything here is explained in this post. And for new people, for new users, or if you create a new account now, you can easily get some of the badges, so that gives you 5 points. So a new user experience, but at the same time, it's easy to get like the first like and first, so it's easy to get these 5 points for new members. I'll share the QR code here again, just in case anyone is having an issue scanning it. Okay. Okay, so the time is ticking. Make sure you have voted in the app competition post. I don't know if you can change the vote now, but if you can change the vote later if you decide to, but the app poll will remain open until Friday. So so you don't have to decide now, but I guess maybe I haven't voted because I don't want to take sides at this point, but when I make the decision, I will vote. And here are the points listed. Let me share. Okay, so right now, if I run this, it will show an update of how many points are being collected. Wow, we have someone who already has 1, 2, 3, 4, 5. 5 points already, 5 stars already, which means 51 points. Quite a challenge. So
Seeing while we're playing, could you tell people more about what sort of posts we've seen for the annual conference this year?
okay, so let me share with you one which everyone can access. If you use DAC 2025 in the search, you can find the topics that are tagged with DAC 2025 or DAC 2025 posters. So all of these are the DHIS2 Annual Conference tags, and there's been a lot of innovations shared in the past 2 months from the community. Some of these are, most of these topics are also presented in the annual conference. The post owner or the post author is usually the person presenting, so you can go into their topic posts, reply with a question, and if you have a question or if you have any insights or comments, or if the use case is something that you are interested in also applying and working on, that's something you can check out. You can also find the roundup posts. So if you use DAC 2025 roundup, you'll find, I think, roundup. So you'll find all of these roundup posts, which list on a weekly basis the posts that were posted during that week, and it gives you an idea about what the topic is. So you don't necessarily need to go through all of them. You can go through the roundup posts and get an idea about which topics you're interested in reading. We tried to make it fun to read. So these DHIS2 Annual Conference roundup posts were basically not exactly a summary, but more of headlines and questions to get you thinking about what the topic is, and if you'd like to read it and check it out. So right now, if you are browsing these, you're getting points. So two likes for each DAC 2025 topic you view or like. Definitely you can mention another gamer, someone in the game, in the challenge. I've made this report easy to access for everyone in reports, which also has this DAC 2025 innovations topic popularity. This report basically shows us the top topics based on views, replies, and since it was posted. I need to remove this new topic post here because it's a system post, but the other ones here are posted by participants. So I see that number 1 here, which has a number of views, likes, and replies. is digitizing DHIS2. So you can check those topics out. And for this game here, it's also this report, this table or leaderboard is also accessible.
All right, it looks like we got some competition here. We have Eric Chingala coming up second. He's gotten many more points since we last checked. For those of you who are just joining, if you want to play a game, we're organizing a short competition on the community of practice. And so if you scan the QR code that you see on the screen, you'll be taken to a page that instructs you on what the points are for the game and how to win. So right now we've got some good competition. It looks like we have around 20 people playing. Ken Yuri is in the lead with 51 points right now, but Eric is catching up. So you have a few minutes to join and see if you can take the lead. And so, Kasim, while we're waiting and people are joining, what else have you seen from the community this year for the annual conference?
Well, I mean, the community, you mean in the community practice, and people in the community practice, it's been really the past 2 weeks and before, like while these annual conference topics are being posted, they're basically being engaged, as well as like they're asking, different. Some of them are working on their projects and asking questions, but also you'll find that some people are interested and like they're reading. If we go through the roundup posts, you'll see that there is a lot of not in this topic, a lot of clicks in the links. So for example, in this one, you can see some people are going through these and reading these topic posts, but also just yesterday there are a lot of people in the annual conference posts that are posting and sharing. For example, yesterday virtual participants were sharing their questions and their some of their comments, and some virtual participants also asked for resources, and in addition to like adding comments on the Zoom while live stream, you can see here in yesterday's day 2 or day 1 actually topic posts. It's great to see also some of the people who are new to the community and learning about DHIS2 joining in the annual conference. It reminds me of the excitement when I first joined the community and I saw the banner announcement about the annual conference. So it's nice to see the community members being engaged on the community platform as well. So there's this virtual interactions between the members. And also for in-person participants, you're welcome to remain engaged in the community now or after the conference, to ask you questions or see what people are talking about and what use cases they're working on. I would like to run this to see who's winning and who's collecting more points. The challenge is really big here. We have a number of most of the if you're collecting these high number of points, it would be that you maybe are replying to new topics that are tagged with, or replying to topics that are tagged with this DAC 2025. Also, if you receive a badge, if you mention someone else who's in the game right now in a post, so if you reply, for example, to this topic post and you and you mention someone from the challenge, you get 3 points. Every 10 points here, every star here is a total of 10 points. So
okay, and I think we have about 5 minutes left, so there's still time to catch up with the leaders if you are just getting started. I see we have at least 1 or 2 people here in the audience in our physical space who are playing, so that's great to see. For those of you who are
It looks
here,
like
have you looked at the community practice this year? Anyone, raise your hands if you checked out the community practice during the conference. Great. There's a lot of good stuff there. A lot of the abstracts that were submitted have also been posted on the community practice, so you can go there and read more detail and maybe find out which presentations you're interested in seeing or ask questions there if you didn't get a chance to talk to the people during the conference. So it's a good way to interact a bit more, even outside of the limited time that we're here together. And Gussine's been doing a great job, as he mentioned, of posting these roundups every week. We've been posting abstracts, people have been posting abstracts on the community practice every week, and every Friday there's been a roundup post summarizing which ones have been shared in the previous week. So you can easily find them through the headlines and a short description of what they're about. So I definitely encourage you to check it out if you haven't looked at it yet. And this game we're playing now is a good way to familiarize yourself a bit more with the platform if you haven't used it before. We now have more than 10,000 people on the community practice from around 100 countries, I think, at the moment. So it is a very diverse group. You should see a lot of posts and comments from people all over the world talking about what they're doing with DHIS2. So again, I really recommend that you look at it if you haven't looked at it too much before, or if you haven't been there for a couple of years, maybe go back and see what's new now, because we have been working on it continuously to make it more and more hopefully useful and interesting for everyone. And Kasim, what do you think? How are we doing on our competition here? You want to check the score again?
yes. I was making a tiny change to the table here, and it was to show the person's profile with the profile image. I think it might look nicer. And right now, I think the number of stars are exceeding the width of the screen.
Wow.
There's a competition between Raphael and Joseph. So Joseph was already making the top row, but now Raphael's catching up again. So it's still a challenge. Eric was going all the way up, but he pressed the brakes for some reason. But you could still try. You could still bridge it. And I see some are already joining and increasing their total points. Let me run one more time. Well, I told you the competition is on. I'm not sure who's really going to win at the last minute. Eric also joined, raised the total number of points.
Yeah, I think it's gonna be close. You might have to do an official countdown so you get a final time, so you know who the winner is when the clock hits 0.
Yeah, I don't know if I have a timer here. Let's see. So how many minutes do you think we have? 2 or 3? I can start this 3-1.
I think 1 minute,
time.
because you're looking at your clock, we're at 9:54 almost. We want to end by 9:55 in your time, so.
Okay, let's start this. It says, wait, 5 minutes. I want to change it to 1 minute. Okay. Yeah.
Okay, there we go. It's countdown is on. So this is everyone's chance. If you want to come up to the leaderboard, we have maybe move the clock so people can still see the QR code if anyone wants to scan and have a last minute effort. There we go. All right, so this has been a fun community practice game. Hopefully everyone's had a chance to check it out. If you haven't looked at the community practice yet, it's a great thing to be part of, just to connect with people around the world who are part of the DHIS2 community. Al Ghassim has been our CP coordinator for the past several years. He's based in Sana'a, Yemen, and we have tried to get him here in person several times. Unfortunately, it's a very hard country to travel from. So as we're waiting to see the final score, everyone just give Al Ghassim a round of applause for being a great coordinator.
Thank you.
We really appreciate all your hard work. And now in just a few seconds, we are going to see who the winner of the 2025 Community Practice Challenge is. Okay, 3,
1, 2,
2, 1.
okay.
Here we are.
Congratulations, Joseph.
All right, Joseph Chingala, congratulations.
Congratulations. And the second position also
All
was
right,
for
and Gassim will be online
was
throughout
the
the
top
conference
player.
helping out. So if you have any questions about
Thank
community
you.
practice, just ask him.
Right.
And we're going to move on to our next plenary in just a few minutes. We just have to get the presentation set up here in Oslo. But thanks again for joining us from Yemen.
Thank you. Thank you. I'm happy, and I'm happy to see all the virtual and in-person participants. Your participation and your comments are really great and heart-touching. I loved yesterday's plenary session. It was really close to everyone's heart. So thanks.
Thank you.
and then parallel sessions the rest of the day. I just want to inform you that there is a kind of an alarm going on. It's a kind of an emergency test between 10 to 12 and 10 past 12. So I don't know what to do then. What do? You answer something on the phone, and then it's not, because it's going on all your phones connected to the mobile network. So it's a test. So I think you can click something. I'm looking at some Norwegians here, but no one is actually telling me anything, so we'll see. I've done it. Marigun, do you remember? Oh yeah, we had to wait it out. Okay, don't do anything, but it will be destroying the talk at that moment. But we survive, we are flexible and agile, so no problem. Okay, so this today, oops. You can put Jason has a workaround. You can put your mobile phone on flight mode. Then nothing will happen. Super good idea. I didn't know. Okay, we have a busy plenary. No, not working. Okay, this one is not working, Max, by the way. This one is not working. Oh, I had to switch it on. Okay, thank you. Still not working, but then I do like this. No. Next slide. How do you do next slide now? Everything is out of my control. So is it working now? Yeah, cool. So you see, we have a bunch of people presenting today. That is because it's a huge, not a big community. It's actually everyone in the project will be on the stage today, I think. We are few, but furious and active. So we have a bit of a menu. This is a taste for what's going to happen later today. We have a whole session on climate app, and we have a whole session at 11, and we have a whole session at 3 on the CHAP modeling platform and modeling app. However, now we will give you an appetizer for all of you that join other sessions. And we will have, starting with the climate app, then Jaira will talk about one of the interventions. We have many interventions. We have suitability mapping from Uganda that you will hear about, and 11 if you want to hear, for malaria. And then we have malaria stratification intervention that has been happening in Togo that Jaira will talk about. We will then have Geir Kjetil to introduce the ideas and the work around the modeling platform of ours. And then the boys, Eirik and Herman, will do a demo of the modeling app, which is pretty cool. And then we will end the show with Pamod presenting a very, very new work that is happening in Sri Lanka together with our partner Cicero on air quality and health risks. That's we are looking forward. So Björn, welcome. You have 15 minutes-ish. Okay.
You can hear me? What about now? Yeah. Okay. So yeah, we have been working. I've been responsible for the climate app. So we have been working on that you should get easy access to climate and environmental data in DHIS2. But I just wanted to start by lifting the discussion a bit, because the climate data itself won't do much change. It really needs to be adapted to the user to make it useful and actionable. So often within this field, we talk about climate services in addition to just about climate data. And there is a strong focus around building good climate services for adaptation. And this is not only for health, it can be for all sorts of fields of society. And the climate service really focus on the end user and what are their needs to use the data. So it can facilitate decision making and action. And often you need to make really tailored and customized products for different users. And while DHIS2 is a generic product, we are not often like thinking
that far towards the end user, and at least not on the global team, but I know the country teams are doing this all the time. I could also mention that the climate service is not only often about climate data, it often also includes data on other environmental factors like environment that we will talk about. And also when we go looking into predictions, for example, intervention data, social and economic data is also important. And often this requires a multidisciplinary and cross-sector collaboration. So for example, to get the Met Office and the local climate experts on board in doing this work is crucial. So what is a climate service in DHIS2 or in a health management information system? That is a question for us to answer. As I said, it's hard for us on the global level to team or to make these end user services. Luckily, we have the HIS groups, and Patrick and Yara will later present 2 examples today that taking this data further and, for example, look at malaria suitability or risk mapping. There is also just an image here from the Minister of Health in Laos looking at predictions for that we have made with the CHAP platform. So just having this active engagement, and we also see Herman is doing his field work in Rwanda to just make sure that the graphs, for example, are understood by the end user, if they get the same meaning out of it as we want to tell with the chart. So this is an ongoing effort, and hopefully some of these things that we do can actually lead to change of behavior and action at the end. So then we have more looked upon the thing we are doing as building blocks for climate services. And I think that's what we are really good at. And DHIS2 is to making these generic building blocks. And also when we see how DHIS2 is then used in not only in health, but in other fields as well, we see that this approach has been very successful. So we look upon both climate app and the modeling app and the CHAP as building blocks that you can build on top. But then you need to create this active engagement with the users and the collaborators, the Met Office. Yeah. So right now I just placed the climate services on top. That could be dashboard, that could be policies, it could even be tailored new apps. So it's a lot of more work we need to do in the years to come. So this is just the beginning. But just having this foundation, having it very easy to get climate data into DHIS2, and then making that harmonized with the health data, it's a good first step. We are, as mentioned, it's not only climate factors that really influence the disease spread and outbreaks. And I very much recommend this book from Madeleine Thompson. This one, Wellcome has paid for it to be fully open. So if you just Google it, you will find it. You can download the full book for free. But you will see here on the list, so there's just a list of different diseases. So here's malaria, dengue, and cholera. And you could see climatic and environmental transmission drivers to the right. And we have just we started with the core climate variables. Now we have also been starting to look into more environmental factors that you can now also get harmonized and get into DHIS2 and later on used in this modeling and CHAP tools that we are having. So this is the overview of the data sets we currently support. So last year when we were here, we only had this ERA 5. This box in the middle is from the European Center for Medium Range Weather Forecast. So it's often mentioned as the best data set globally for climate there is. And it's a big data set. It's covering 50 variables and the full globe. We also had an early integration with yr.no. Those who are Norwegian know that very well, but all the data behind yr is also in an API and also something you can access in the climate app for a single health facility. But then as we learn, as we go, we have added more data set. So especially we saw that there were limitations with this ERA 5 when it comes to precipitation. It's quite good for temperature. If you compare the ERA5 global data set with local station data, it's we have made comparisons with Laos, and it was a very nice, very well linkage between the local data and the global data. But precipitation is harder, especially on these global data sets that rely on satellites. It's hard to measure rainfall on the ground. And even also with station data, because rainfall can be so localized. So it's very hard to go from one station to a full health region and say that this amount of precipitation. So that is more tricky, but then this CHIRPS data set has been proven to be much better. It includes much more local station data, and it also have a different technique of measuring rainfall. We have also seen this for our own sort of resilience, that not relying on one data set is good, because some of this, especially this American-based data set, is now at least open for a discussion. So I know that this CHIPS data set have funding until end of the year, but hopefully they will be prolonged. But we can't really, we need to have different data sets in the mix. And then we have recently added different data layers from NASA, elevation, vegetation, and land cover. And then I could also mention that there is a big demand of using local climate and weather data, so basically from your local Met Office. This is often hard because the data is not digitized. There are big gaps in the data. But there is this initiative called ANAX, so that is from IRI, International Research Institute, which is one of our core collaborators. So they're helping the local Met Offices to build this local data set based on all the local data they have, but then blending in or filling the gaps with these global products when there are gaps. So you get a consistent data set, but much more accurate for the country. And then, we're looking into new data set. And just also to mention here, you are not restricted by this climate app at all. You know, the HIS groups and others, you know very well how you can import data into DHIS2. So whatever data you have and you would like to align with health data or use in the modeling tools, just import them into DHIS2 and you should be able to use them. So we don't want to force any data sets on you. We often talk about what we call our gridded data sets. And this is very useful for us because they have the full coverage of the country. Compared to a single weather station, this has already sort of been interpolated, so you have values for every district. You see there are, especially with this ERA5 land that we are using, there are some islands that fall outside because it's only covering land area. So I know that Mozambique have had some issues. If you have a district only with some small islands, you might not get a value from this data set. But the good thing with this data set is that we can take the average within a district. So we can count the different sort of cells that fall within and get the average value. And this is basically, we are based on Google Earth Engine. We are looking for open source alternatives to do this, but this is the very great benefit of using Google Earth Engine, is that we can send in the boundaries of this district and then get back an average value for that specific district. And it goes very fast. So you showed this yesterday. No. So this is the data set we have added since last year. So I already mentioned, we have added this heat data set. So you can see on the right there, comparing 4 districts in Nepal. We had added the CHIRPS data set, and also a benefit with that one is that it's much better resolution than the ERA5. So it's 5 kilometers compared to 9 or 10. And then you can really see there is an increase of resolution when you go to the land cover data sets. And hopefully when you saw back on the list, there are even they mentioned the water pounds, for example. So even 250 meters won't be enough for many use. But hopefully for the prediction and high level, it's enough. But there are now at least freely available data sets down to 10 meters resolution publicly available. So we are continuing looking and investigating. Some of these very detailed data sets are, because it's the satellites orbiting and sometimes there are clouds and so on. So just to get a consistent data set out of those very detailed is hard. but we are working on it. I can also just mention some improvements are made. So before you could only import daily data, maybe you don't need it because you only operate on weekly and monthly in your DHIS2 instance. So that means that you can also import weekly and monthly directly. We have this, you was mentioned the calendar yesterday, so that we have also included in the Maps app. So you can use we have not selected the easiest countries because both Ethiopia and Nepal is one of our 10 countries. And they have challenging calendars. And different. We also made, for example, when we make this screenshot, because always the data, it adapts to the data you show. But yeah, we have made some settings, so it's easier for you to make these screen grabs of the charts, and they will all have the same axis or the same view. So yeah, more about that. We will have a separate session on the climate app, so we will go more into detail. Yeah, this is this ANAX initiative. So it stands for, it's for Enhancing National Climate Services. So as mentioned, this is one of our core collaborators. We have basically, since we are getting the funding and we are sharing the funding with them, we are also in the position to say what we need. So they have made an API that replicates the Google Earth Engine functionality we use. So you can do the same with this local data as you can do with the Google Earth Engine. So basically, soon you will just open the climate app. And in addition to the global data set, you can select national rainfall and temperature and import that data in the same easy way as you can with the global data sets. And they have already made this a separate web interface. We don't want to lock people into DHIS2. I think this climate and weather data needs to be open and available for everyone. So they have also made what they call the ANAX data sharing platform that you can also go directly without going into DHIS2.
It's not for every country, huh?
No, it's not for every country. You can see the country where they are there. And also important that this is a bit similar as with DHIS2, which is owned by the Health Ministry. This system is owned by the Met offices. And you need an access agreement with them to get access to this data. I will hand on to Jaira.
Super. Then I will just introduce Jaira that will do the talk about the use case of using climate data for certification and planning, malaria interventions, and thank you to Map Björn. There will be hopefully time for questions in the end.
Okay, good. Thank you. So I would like to share with you the topic about malaria, stratification, digitalization in Togo. So in Togo, it was reported in 2024 over 2.1 million malaria cases, and including 30% of under 5 children age group, 900 case days, death cases, and over 70% of under 5 age groups. So this shows that malaria cases or malaria disease still remain a burden for the health ministry systems. So the concern of this situation is that malaria disease can be treated and most importantly, can be prevented. So to address this prevention, the National Malaria Control Program called PNLP have conducted over several years a campaign that called SMC or Seasonal Chemomalaria Preventions. So what is that SMC? SMC is an intervention that provide anti-malaria drugs to the age group of children under 5 years to prevent the malaria during the period of the transmission peaks. So, however, since malaria is a seasonal disease, we need to address some questions like when these transmission peaks occur during the year in the country, and how long this transmission peak lasts, and also where if we consider that, for example, in Togo, different locations have various or different weather conditions. So we need to take all this information account. So that's where the stratification process come on board to help for decision making, like first, how many districts are eligible for the campaign, and also how many cycles are needed for each district. And when we talk about districts, we want to know also for each district when the campaign needs to start and end, and the durations. So notice that previously, this stratification process were done with the PNLP, the National Malaria Program, manually outside the DHIS2. So they have to pull up the malaria case data and do all those processes with other tools. But now that we have that possibility to integrate the climate app in DHIS2 in Togo and having all those climate data, with the collaboration of the malaria program, DHIS2, and also other stakeholders like WHO country, and also the Ministry of Health, we digitalize the whole process of stratification in DHIS2. That will help the program to automatically do this process in real time. So here we have the first map showing the number of districts that are eligible for this campaign, for this intervention in the country. It's based on the calculation of precipitation peaks. So we have that rainfall data, and we did all these calculations through indicators. The second map showing the number of cycles that are needed for each district. So in red, we have 5 over 5, the cycles, and in orange color, we have 4 cycles for those districts that are eligible. So this calculation is based on the consecutive month of the precipitation peaks. And then we have these visualizations, heat maps showing the switch period to start and end the campaign, the SMC campaign over the country. So it's based on the 5 years data. We use 5 years data, and we did a calculation of a percentage of malaria confinement case for children under 5 years to have this design that's showing. So here we can notice that in the country is most of the time the peak starting from May and end from June. That's we consider like the good period to the campaign. And then the last one is showing for each district the sweet period or the sweet time or sweet month to start. Like every district cannot start at May. It depends on the number of cycles that you have. And so based on some calculations here, the calculation is doing with the percentage of malaria cases for children under 5 years. And we consider 4 years. For these 4 years, we do the median. And where the median is highest, we consider that is the sweet period to start the campaign for these districts. And then based on the number of cycles that the districts had, we decided to have the durations. So that is what we digitalize for the stratification process. Thank you for your attention.
As everything we do, this one will be available for everyone, of course. And then we have to learn what need to be done before the digitalization process is of course, important. Whatever you have in DHIS2, then we can make intervention on top of it. So over to Geir Kjetil, talking about this fish.
Yes, so the connection is very natural from what was done now and presented from Togo, because the next step we can then think of is like, can we directly predict the number of cases? So if we have the climate data available in the country instance, and we have looked at past connections between climate and health, can we now for each region see where will the peak be and directly predict it? So we have the data, the same data that is used in Togo, the climate data from the climate app, the health data, routine health data in the DHIS2 system. And then we want some kind of formula in a way that translates these past data and the climate data over to what will be the number of malaria cases in the coming, for instance, 3 months. We don't want to sit and specify all these formulas, so that's why we use machine learning. And machine learning and AI is kind of an automated way of learning such connections, actually learning formulas like that. And then as part of this, it will learn kind of what the ideal temperature and the ideal rain is in each region. It will at least try to estimate it. And then you can end up with something like this, which is from our collaborating group in Barcelona, who have made this from Vietnam. So it's like in January, a given year, which regions of Vietnam have a highest risk of going beyond the threshold of malaria cases. The current way that this has been done before HISP entered the scene is not ideal in our way of thinking, and I'll come back to that. So what's typically happening is that there is a disease program getting funding for a specific collaboration with a modeling group, often in the global north, often in Europe. This group gets the data, the malaria data, has a lot of iterations, maybe spends a whole year developing, modeling, evaluating, seeing how well it works. And when that group is happy with it, they send the predictions back again to the disease program and says like, now this worked well on my laptop. I think we have promising predictions for malaria. And we think you should put it in operation. And if now the country wants to put this in operation, they have a script that runs on a laptop in a university in Europe. And then you try to get this to work on the ground in your organization, in your malaria program, with the data streams in DHIS2 and so on. So you have to kind of spend a lot of time afterwards. So, okay, since we come from HISP, we think that we cannot do it this way. A prediction model must match the context. It must be different in the context, but we cannot develop everything from scratch. So we'll need a long-lived generic platform that can be tailored and where all these local innovations flow back. So we need kind of an action research approach to AI, where you have long-term collaboration, advocacy, and trust. So we want to go from this situation where there's a lot of different modeling groups developing a lot of different custom solutions for each country where they're involved, to more a model like this, where different modelers come in, they develop different types of model, make them available in a global reusable pool of models. Then the countries come in and they can tailor and evaluate to their context and also have a feedback that I'll come back to. Also, since we have this global pool of methods, it can already be connected to DHIS2, which is what we have worked a lot on. So that data flows in and results flow back. So that is the CHAP modeling platform. It supports configuration of models, tailoring of models, training these machine learning models, tuning them to work well in a context, evaluating how well do they really work, and sharing the models between countries and between developers. It's really a platform for reuse, or in other words, a platform to cut duplicated efforts. It's also a platform to give countries the ownership, because as I'll show soon, the countries are much more tied into the loop. It's a collaborative and open source project. Everything is open source from day one. The models, the platform, the connections to DHIS2. It's a common base for training and experience sharing, because if you have some of the same models available, it's much easier to discuss between countries and learn between countries. Because you can say, like, in my country, it works this way, and you can see, look at the same plots, the same models, and see how they behave. And in principle, which I'll come back to tomorrow, it can be used for any kind of machine learning task. So it can go beyond malaria, dengue, Could even be logistics and education perhaps, but that I'll not go into now. So we want, instead of to have this one that I showed before, which is a bit isolated model, we want to have this. And Christian don't like when I make these complex figures, but then I promise to go through it step by step. So this is kind of the whole picture. What enables this is a unified computational infrastructure, where we use the HISP network with container setup, LXD, and all of these things to have a common way where models can easily flow into a country. So the countries have kind of many countries have a bit of a similar computational servers and so on. But even if not, this is kind of based on what's called Docker, so it can flow easily into any kind of server infrastructure. It also has evaluation functionality and a lot of these things that you need around it. Allowing all of this development process to now instead happen within the country. The data doesn't need to leave the country, the malaria data, the dengue data, and other types of data. It's a development between local modelers, and we really want to now push ahead that local universities in the countries connect to the international community, of course, and together develop these models, develop machine learning methodology, so that we can have this global pool of CHAP compatible methods that can flow into any country that have installed CHAP. And then we can have this iterative, agile development that we really believe has to happen. We cannot just throw in a single model and hope that it works. You have to try a model, you evaluate, you see it's not good enough, it's not hitting the peaks. There are some specific things in the country that it doesn't take into account. Then you go back and you improve the models. Collaboration between local universities, international community, and you go back with a new model and you loop through many times. And when you're happy with it, when you have rigorously evaluated this, maybe a year or two of evaluation and development, then everything is already connected. You have it in your local country infrastructure running with connected to DHIS2. Data flows in from DHIS2 routinely. Results flow back. And as Herman and Eric will show soon, all of this is actually working. We just need to find the good way of doing it, but the basic computation infrastructure is now in place. And then finally, of course, the HISP group, the country HISP group will be central for so many of these phases. Setting up the data streams, helping install these infrastructure within the disease programs, also inside universities, so you can have a collaboration between ministry and university, public health institutes, also to operationalize it when it's really ready, and to facilitate all these interactions between actors. And with that, I give the word over to the real work.
Thank you, Geir. There will be a session at 3 o'clock on this one, and as well as using AI in DHIS2 tomorrow, which is more generic, not the climate health. So now I will welcome Eirik and Herman. If it had been space on the stage, Birk would also be here, but we let the young boys presenting. It's part of Herman's PhD, actually. He's working we are having meeting every week with each of the 10 countries in order to be able to support and get feedback on how this modeling visualization can happen. And actually, just to warm up a bit, last Thursday, before the climate health conference, we got some feedback on new features, and on Monday it was a new release on the new app with those features. So they have been working day and night the whole weekend, including Birk, Eirik, and Herman. So welcome to you guys. We are so excited.
Thank you. Good morning, everyone. It's nice to see that so many people have showed up even this early. That means that we're probably doing something correct. We're trying to do some more concrete things in this demo. We're trying to bring all the things that Björn and Geir have talked about, and actually doing a live demo as well, which you probably shouldn't do, at least not before lunch. At least we'll try to make things a bit more concrete. We'll try to get you like a 101 how to get started with the CHAP modeling app. My name is Eirik. I've had the pleasure of working with many of you. I was part of the tracker team for a very, very long time. I'm a software engineer at the core development team here at the university. I'm also joined by Herman.
Yes, I am Herman Tettag, and I am a PhD student within the climate and health team.
Yes. So we'll start off. There are some things that we want to like go through and really talk about it as we do it. We want to show you how simple this is, and we want to show you basically how to get started with evaluations and all that. So this is the modeling app. This is the front screen. This is what you get when you open it up. I'll go directly into the evaluations, and let's see.
We could just say that this app is kind of the front end of the CHAP. So this app exists within DHIS2 and connects to the CHAP platform, as Geir mentioned, that serve as a backend service here. So this like connects to the CHAP platform. Yeah, over to you, Eirik.
No, that's correct. And one of the things that we know that we sort of, once you open the modeling app, the first thing you want to do is that you want to try out a model, and you want to connect that model with your DHIS2 data and see how it performs. So we're starting to create a new evaluation here, and I'll just jump into the models directly.
Yeah, and as Geir mentioned, CHAP support many different models. And in this list is a view of the different models that CHAP supports. Some of these models are developed by the CHAP team, by others are adopted by the CHAP team, meaning that there's someone else that have made the code, but we have tried to integrate it into CHAP. Meaning that CHAP is not a model itself, it's served a purpose of being a platform, and therefore could integrate several different models into CHAP. So there could be like slightly difference between these models. Maybe some are very good at when you have little training data, and other are maybe better for predicting outbreaks. Some are maybe better in some other climatic zones. So there are like small varieties or larger varieties between these different models.
So we have a couple of different ones. For now, we'll choose the CHAP EVARS model, which is one of the models that comes with the CHAP platform out of the box. I'll do it very, very quickly. This is how you get started with an evaluation. You basically give it a name. You say for what period you want the data, and here it's like health-wise, it's best to include the most data that you have that is sort of representative to what you're trying to predict here. I'll go for 2020 to 2024. And what we're using here is real production data that we've been allowed to show you, and it's based on the Laos HMIS. Since I chose the CHAP EVARS model, I get this list where I can map the different things to DHIS2 data items. It has a target, that is what you're trying to predict. So in this case, I'm trying to predict dengue outbreaks. So I'll choose that as a target. And then all of the different covariates here, we'll get a bit more back to it, but it's depending on the model. So you as a modeler can choose what is it that you want to include in the models and what you want to keep out of it. For now, I'll choose population, and what I'm selecting here is the different data items in DHIS2. I'm selecting data elements. And also to say here for rainfall, for example, I want to select the precipitation. And as you can see through the climate app, we've been able to import both the CHIRPS data and the ERA5 data for different covariates. So for now, I'll just choose the CHIRPS. Also for temperature, I'll choose the ERA5. That's the best one. I can save it. I can also do a dry run to show that everything is correct. And from that, I can start an import. As you can see, it's starting to run and everything is happening in the CHAP backend. And it's actually training a model now and doing everything, and it will give you results back. With amazing visual effects and nice editing, I've cheated. So we'll go directly into an already done evaluation. And for now, I can choose the first one here, for example. And this is what you get when you're actually running a model and trying to see whether it works on your data or not.
Yeah, so I can try to explain a little bit of what we are seeing here. What we see is that we see a prediction that are made from a point back in time. Meaning that, for instance, if we zoom in on this, Eirik, it's a bit better to see that for now we see that we have made a prediction for April, May, June, and now, yeah, there for April, May, June. And we see how that predictions aligns with the real cases. That means that the model has now only used the data that exists from the beginning of April 2022 until April 2024, train on that data and try to predict how the disease will evolve into the future. And as we now stand in the future, we can now add upon the real cases, the orange line, and see how good it performed compared to the real cases. And as you see here is that the prediction were quite aligned with what actually happened. You see that it follows the curve. This is very interesting to inspect for different organization units, for it could be like difference of how the model perform from place to place. And it could also be, it's also interesting to see how good the model is catching the peaks or during the season. For that is maybe the most interesting to see, that if a model are able to predict the size of an outbreak or a season, and also when it will happen. So this is like things that are important to assess when we are evaluating models.
I think it's also important to mention that, as you can see, there are some places where the models really can be able to get you good results. But in the same evaluation, you will sort of see other organization units where it doesn't perform as well. And this is sort of the beauty of the modeling app, where we try to give you some more advanced features into really being able to throw everything at the models and getting out the back, and then it's really up to you to pick the right covariates and run the correct models and all of that to get the best results.
Yes. Now maybe we can look at the comparison thing.
Yeah.
Because what we could do is that, you know, in CHAP we support different models. We have different sources to climate data. So then is the question, okay, which data source is the best to use and which model is the best to use in our country? So what we could do is that we could like see two models side by side, or the same model but using two different sources of climate data. So what we're seeing now is the EVARS model that we have adopted into CHAP with using the SHRIPS dataset, and we're seeing the same model using the ERA5 land dataset. And as you see here, there are slightly differences is how good the model is performing when it's using the different data sources. So this could be a very good technique to try to find the best model to use, and also the best climate data source to use.
SHRIPS, that's precipitation, huh?
Yes, correct. So,
Looking at precipitation.
so both these are using precipitation data.
Yeah.
Yes.
So that's one of the good ways of trying to evaluate one of your models and seeing if it actually creates sensible outputs or not. We are also trying to throw more values at you. For example, you have the CRPS, which is a normalized value that tries to like give you a normalized value so that you can compare the different models. It's not in itself good enough to say whether a model is good or bad, but it's more things that we're trying to incorporate so that you can actually get some sensible things out of it. As you may know with machine learning and stuff, there's a lot of reasons why your model may not perform as well as you want it to. And one of those things can be bad data. And we all know like there are ways to get around bad data and clean up your data and all of that. But in machine learning, you also have the models itself, and you can tweak the models. And this is one of the new features that we're introducing in this last release, is that we're trying to give you a good way of doing that through the modeling app and basically being able to change things as you go. So we have this new thing where you can configure models based on model templates or like base models that you can upload. So you can bring your own models into CHAP, and then the user can actually use that model and tweak the different settings so that it should perform better on their model. For example, here we can choose the same model that we just used. We can create a new one, call it DAC, and here I can change, for example, the lags, which changes how the model behaves according to a lag effect. For example, if it rains heavily, we need to know, is the impact coming in 3 months or in 6 months or in 2 months? All these things. So you can change that. This last thing is also quite important. Right now, this model only requires population. But as you can see, what I did previously is that I also added temperature, and I also added precipitation. In this list, you can also add new things. So you can, for example, add heat stress, elevation, all of these things. As long as the model is configured to be able to take in those things, it will work. So you can add all of your different things. You can add intervention data, you can add more climate data, all of that. That will be added and will be added to the list that we just saw. I won't show it now. I think that was the main gist of what we're trying to do. There are a lot of new features coming to this, and we'll talk a bit more about that later. I think in general, if there's something climate modeling, anything at all, please chase us down in the hallways. We're happy to talk more about it. And yeah, I think that's it. Thank you so much.
We're so good in time, so we can actually have some Q&A if anyone have any questions to the boys about this fantastic innovation, how it can be used in countries. You are allowed. If not, we invite the next speaker, because we have an expert launch today. Oh, there are questions, yeah. So I have my running shoes, so I can run. We have people online and we don't hear anything.
Thank you so much for the presentation. I was just wondering, for the data sets that are available to be integrated, are those the same data sets that were mentioned this morning? Is that only the ones that are able to be integrated?
So the CHAP platform in itself is built in the HISP way. So everything is generic, everything is up to your implementation. When we search through the different data items, that's your data items in your DHIS2 system. So we're saying, bring us a data element or an indicator or a program indicator or whatever, and we'll get that data from the analytics. So you can import it through the climate app. You can also use local weather data if that's what you want. You can also use disease cases from your actual implementation and stuff like that.
And one important thing that is very important when you train a model is actually intervention data. Because if you have huge intervention in malaria stratification, for instance, and then you're not including that in your training, the model will predict wrongly. So intervention data, how to make hold of the intervention data, that is one of the challenges. So absolutely, good question. Thank you so much. Any other? Did I see any other arms, hands? Yeah, we have one here.
Since you're right there. I'm Gagnon from UNESCO, and I work in the education sector. And so we have a climate model also for doing very similar things, but for education systems. But we also have like this model. We try to at least predict also rainfall and other climate events to anticipate attendance and impact on learning outcomes. And so I'm not sure I saw predictions in the model unless I missed something. Are you working on this?
Yeah, so you can say that's like predicting weather. I think that's a bit belonging to the climate services, isn't it? So maybe if you want to, Torbjørn, you take it.
Yeah, if it was, but because you would like to use forecast data also, yeah. So it's something we are looking into. So, there is not a global data set with a good forecast from all of, or if someone knows about these data sets, please tell us. But often these seasonal forecasts, they need to be tweaked for different countries. But it's definitely something we have on our agenda, and also something we plan to use ourselves. So because climate is actually something we can know a little bit about into the future with the seasonal forecast, and especially around this temperate or now the equator area, it's more predictable than at our latitudes. So yes, we are considering that. Yeah, so we have the 10 days forecast, but that is only for the location, and it's often not enough time ahead for these interventions. So yeah, let's have a chat.
So to be continued. Thank you so much for this fantastic demo. And this will be to be continued because we have new releases all the time. So follow us on everything is documented, everything is freely available. And for the educational sector, if you have DHIS2, then you can plug and play with the climate app. And then you can later also install the CHAP platform and then run the modeling app. Without the last CHAP platform being updated, you cannot run the last modeling app. So this connection is there. So it's a front end to the CHAP platform, modeling platform. So over to Sri Lanka. You know surfing boys this time, huh?
Different ones.
Sometimes we have surfing boys as a background. So over to Pamod and reporting on the collaboration with CISRO as well. Okay.
Yes. Good morning, everyone. I'm Pamod Damarakoan from HISP Sri Lanka. So today we will be talking about air quality and health risk, and I will be giving this presentation on behalf of group of organizations, as mentioned here. So we have Ministry of Health Sri Lanka, National Building Research Organization in Sri Lanka, Center for International Climate and Environmental Research in Norway, the HISP Center, and the HISP Sri Lanka. So we'll be talking of a use case that we have in Sri Lanka, but I must mention I'm coming from a combined background of medical, public health, and informatics. Some of the things that I'll be presenting are maybe a bit more technical, a lot of statistics and climate expertise involved. So if you have any queries, I'm happy to connect you with all the partners that we are working with. And also, I must mention, this is not about just one technical implementation of DHIS2, but we will also explain how our approach, the HISP approach was when addressing this issue, which involves a couple of different partners, new implementations, a lot of agile developments, and etc. Okay. I hope this works. Okay. I have the clicker. Sure. So in Sri Lanka, when we talk about climate and health, we have three broader use cases. First one is on malnutrition. Then we also have another one on vector-borne diseases. And finally, on air quality. So this is what we will be talking about today. Right. So when we talk about air quality, what do you think? What comes to your mind? What do you think of the quality of air right now in Oslo? Good, bad, moderate? Too good. Okay. So this is a screenshot that I have taken a couple of days back, maybe 2-3 days back, and this kind of shows the air quality index. So basically, air quality index is an index which has a value ranging from 0 to 500. The lower the value, the better, right? So you see, like most of Norway, the values are in this green zone, quite low values. But if you compare this with the situation that we have in Sri Lanka around the same time period, you see a lot of yellow areas, which are kind of like moderate, so not so good. However, if you talk about the South Asia region, this is the situation, right? So we have highly populated countries in this region, and in most of the countries, the air quality situation is not so good. In fact, the only country that is having better air quality at that moment of time is, of course, from Maldives. They had a slightly better air quality situation on that particular day, right? So with all that, what's the reason why Ministry of Health wanted to focus on this area? So these are some statistics from Global Burden of Diseases, highlighting and looking at the ranking of risk factors in Sri Lanka, right? So you see where we have air pollution, it's number 3, right? So a lot of us don't really realize it's a major issue, but it is. I must also mention there is one more, which is temperature, right? So we feel like if you are from tropical countries where you don't have extreme weathers, this may be okay, but it is also of grave concern. So when we talk about air quality, there are several factors that we can measure. So we may think of gases like nitrogen dioxide, sulfur dioxide, or ozone, but in most cases, people talk about this factor called PM 2.5. So what is this PM 2.5? It stands for something called particulate matter of 2.5 micrometers or less. So how much is 2.5 micrometers? It's really tiny, and people say it is 100 times smaller than the size of hair, which I don't have. Yes, but it's so tiny, very small, exactly. So the thing is, so the problem is when you have particles of this magnitude, this small size, they can easily penetrate the lung tissues, and not only it will affect the lung, it can go into a bloodstream and cause long-term diseases. So you can have acute diseases like maybe asthma, exacerbation of asthma, but long-term diseases such as non-communicable diseases like cardiovascular diseases, hypertension, and even cancer. So that is why this PM 2.5 is of really high interest in the people involved with this domain. Right. So we had a really nice opportunity in Sri Lanka. What's the opportunity? We had air quality data collected by this NBRO organization throughout the country, throughout a couple of weather stations. And the really good thing is we had this particular thing. So we have a system called EIMMR, stands for electronic indoor morbidity and mortality data. So basically, what the digital system does across all Sri Lanka, we have like more than 97% of coverage across all the hospitals in Sri Lanka, where people who have been admitted and their diagnosis are ICD coded, and you have it for more than 15 years. So that is a really rich data set of data that we had. And also, we have different EMR systems that are capturing OPD, outpatient, and the inpatient data. And there was a lot of demand to kind of combine these two and come up with some analysis that is really important for planning. Again, as I mentioned, we have a group of organizations involved, local as well as from Norway, and even the DHIS2 are involved. And these are the different roles that were taken care of by different organizations. So whenever we have this kind of an approach, coordination, collaboration probably may be the most difficult task. So we had access to data. So the data was processed in the Ministry of Health, and parallelly, we proceeded in taking the necessary approvals, as well as anonymizing data, because these are sensitive data, especially when we are dealing with individual level. So we mostly dealt, whenever we were doing this analysis, we were dealing with anonymized data so that privacy is ensured. And then all the partners work together. Within a period of like couple of months, we were able to come up with all this, what I'm going to present next. Right. So as Christine mentioned, this is really new work, all this climate health work. So what I'm presenting now is the data flow across all our tech component involved in an ideal setting. But of course, we have been working parallelly. We are not working serially. We didn't wait for one component to be developed. So we have taken some shortcuts. But what our plan is, we have this digital system, and from that, data related to this ICD codes will be fed into one. There is a separate DHIS2 instance for that are maintained for visualizations. And we have this central DHIS2 instance for climate health. And it will have the DHIS2 core, the usual DHIS, and all the climate health services, including CHAP, and some of the models and other tools that we have been developing at the same time. So all that will run on that particular central server. So then we can plug both local and global climate data. And once we have that, we are using it for policy related decision making in the Ministry of Health, and also for open data, because the Ministry of Health has a policy to make some of the data available to be shared across for everyone else to use. And we might even consider using Tanzania's the dashboard app. You never know. We'll see. Right, moving forward. So we had 3 broad objectives. So the first thing is to come up with this high resolution PM 2.5 for entire Sri Lanka. The second is to build epidemiological risk modeling thing to see like to correlate the PM 2.5 with the different health risk. And of course, the third one, which we haven't done much, is to come up with this early warning system. Okay, so let's see what we did related to the first objective. Right, so I think Bjorn also briefly mentioned. So what you're seeing here is a map of Sri Lanka. And all these polygons, the regions that are marked, are different districts. And these red crosses are the weather stations. So we are getting the air quality data from this, the weather stations that you see here. And do you see any issue when if we just rely on these weather station values and we try to connect with the health data that are coming from all the districts? Or is just fine? Yes, so there is an issue, yes. So the issue is, we have few weather stations which probably are located in cities, and if we try to apply those readings to probably maybe somewhere here, right? And if we try to apply that reading from here, somewhere here, it might really not make too much of sense, and it may be even wrong. So that's why we have some issues with using the local weather station data. And that's the reason why we need to develop something called gridded data or high resolution data, which will be mostly covering all the areas. So there will be a continuous coverage, and there will be a spatial continuity as well as more consistent, right? So that's why we always talk about using gridded data. So if you just have the station data, that may not be too much of a help if you are trying to correlate it with maybe health data, which you are collecting in your DHIS2, which is more granular. Right, so how did we do this? A lot of text, a lot of technical things, but if I may try to summarize what we really did. So we obtained global satellite data as a proxy. So in case if we don't have too many weather stations, well, the starting point will be, we'll be using satellite data, which is globally available as a proxy. I mean, as a kind of a starting point. And then what we tried to do is to come up with a model so that we also factor in some other things like, I mean, there are so many things, meteorological data, AVD, emissions. So basically, we are trying to now improve these readings that we are getting from the satellite data. So we connect that, and then we come up with something called estimated PM 2.5, which is okay, but still not good enough. So the next point is, we take in all the local PM 2.5 data that we receive from the weather stations, and finally, we have something called bias-corrected PM 2.5, right? So this is our final product, which is, we are somewhere there, but we are still planning to improve it further because, as mentioned here, this bias correction is a bit of ongoing work. So we are trying to extract more data and feed it into the model and improve further, right? So this is what it is like. So all these what you are seeing are different 25 districts in Sri Lanka. So this is how the PM 2.5 values have been changing over time. And these are some of the maps that you see how it differs from area to area, right? So we have been able to come up with, thanks to special thanks to Cicero. So they did almost all of this modeling and dealing with the technical statistical things related to this work. And we have this now. Okay. And in fact, I don't think we will have time to go through all, but basically what happens is these are different days. So for example, we are looking in 2020. So this is how the high resolution data was like, the raw data, and this is like the bias corrected data. And now we are looking at a resolution of 1 kilometer by 1 kilometer for this. So it's much more better, of high resolution than compared to some of the data that we are using at the moment in the Climate Services app. Yes, okay. So the second one is about developing the health risk model. So again, we have this nice rich data set, and we also have the PM 2.5 data. And one other thing I have to mention is, again, like I think, I can't remember who, maybe Herman mentioned about this, the lag period, because if you get exposed to the low quality air and the response, you always have a lag. So with that, what we are trying to do is to come up with a model where you can correlate the health data with the climate data or the air quality data, but we are also planning to include it further, improve it further by including different covariates as well as effect modifiers like age group, socioeconomic factors, and all that. So this is what we have at the moment. What you see in red are the PM 2.5 data, and this is like the occurrences of different respiratory diseases. We are only looking at the J series of the ICD codes for the moment. This is the same for the different districts. And what we have here is this lag response. So you can see here, when you are exposed to some bad or like some really not good air, you have around like a 30 days of lag period before you get the peak response. So something like that. But we have to improve this further. Right. So this is my final slide, future work. Of course, these three objectives are there, and we are trying to improve it further. Of course, this EVO's coming up with this early warning system is something that we have to do in dialogue with the ministry. And what we are really trying to do is to integrate with the other DHIS2 climate health services that we have, the tools, so that some of this work that was done outside of DHIS2 can be brought in. And finally, to build capacity and ownership with the ministry so that they can take this further, and to also build a local modeling community who can also contribute to this work. Yeah, that's it. Thank you very much.
Thank you so much, Pamod. Any questions for this case? Audience? No questions? Oh. Any questions since we didn't have time to have questions for Björn and for the modeling platform, any questions for that one? If not, we just will mention, since we are so smooth sailing here, the time we have plenty of time left, we just wanted to mention to again show the countries. And you see Sri Lanka not only have air pollution, they also have malnutrition, which is another use case, totally different use case, which is also possible. I think we have don't we have a poster on that one? Yeah, we have. We have actually posters. Tomorrow, you will actually look at 10 posters from all the 10 countries. There will be posters in the lobby over there on the wall. So then people can actually ask the various countries about these posters. And we also have an abstract session later today, I think, with also some of the lightning talks from Mozambique, for instance. Okay, so you can see here that this is the number of countries, and later at 11 o'clock we will hear the suitability mapping that Patrick presented in one of the Thursday meetings, because we have this sharing every Thursday. We share wherever we are at that point, and then Maleke just grab that innovation and get with a bit of help from Patrick, he did the same for Ethiopia. And that we will hear more about 11 o'clock in the Climate App session. So any question for these countries? No questions for the Climate App team. Then we go over to the next one, which is an information for the conference. On the alarm. And then
Right.
Jason's one is with the flight mode.
Yeah. So this is just another reminder that we have this alert that will be happening today. This is for people who are in person here at the conference. This is a national test of the Norwegian alert system. So around noon, you will hear probably some sirens outside, and your phone will also start buzzing and making a really loud noise, which you've probably never heard from your phone make before. So the key message here, don't panic. On your phone, you should be able to swipe this to turn it off, or press an OK button, and that'll disable the alarm. But just expect that to happen around noon today, and you'll probably also hear some sort of siren going on outside at the same time. All right, and that's it for this morning's plenary session. We're going to have a coffee break outside here in the lobby, and then starting at 11 o'clock, there'll be parallel sessions in the building across the plaza. And so just check the agenda to see what the sessions are for today. Thanks for joining us this morning.